Good afternoon. My name is Mark Sexton. I'm the Communications Director for Alachua County. We are holding this press conference to give updates on COVID-19. Today we will be hearing from the State of Florida Health Department in Alachua County, from Emergency Management, and from County Commission Chair Robert Hutchinson. To begin with, I'd like to introduce the Director of the State Health Department in Alachua County, Paul Myers.
Good afternoon, everybody. Appreciate this opportunity to inform the community and our residents of exactly what it is that your county health department has been doing. You know, we noticed a pneumonia in China in May of 2019, and that certainly caught the epidemiologist's eyes in the Florida Department of Health. In December of 2019, when we saw that this was starting to spread, certainly concern heightened. In January of this year, the Florida Department of Health in Alachua County started sending out guidance to our local medical providers, giving them guidance in terms of patient management, in terms of contact tracing, in terms of treatment, and in terms of diagnostic tests that were available. And that has been going on for the last 2 months. Clearly, our containment strategies have lessened the disease burden in Alachua County. As you know, we announced our first case last night, and this is a visitor from Georgia who is currently isolated. Those contacts for the 68-year-old female from Georgia have been identified, and they are currently under quarantine. So while we continue to focus on containment, and that is the identification of cases, the isolation of patients, and the isolation of their contacts, we have also shifted towards mitigation. Mitigation involves the hygiene, the prevention messages that you all have been instrumental in spreading, in terms of hand washing, in terms of covering your cough and your sneeze. Those are all things that we can all do to prevent illness, and not just COVID-19, but we're in the midst of a very severe flu season. The other aspect of mitigation is clearly social distancing, staying home when you're ill, staying away from people who are ill. And I can tell you that over the last several months, the intensification of social distancing conversations with our organizations in Alachua County, including the University of Florida, Santa Fe Community College, the school board, Alachua County government, businesses, we have all had conversations about social distancing, what we are going to do to continue our mission to continue to provide services to the citizens of Alachua County. There's been a lot of conversations about mass gatherings, and while we don't have any community spread in Alachua County, that certainly is a consideration for event planners and for those who are going to attend these events. I have to say that in terms of mitigation and containment, these are all very important considerations to buy us time. We have to buy time in order for a vaccine to be developed. Once a vaccine is developed, I will tell you with all sincerity and confidence that Alachua County is second to none in this state in terms of doing mass vaccination clinics. We demonstrate that every single year when we go into our schools. Our Board of County Commissioners have invested in that program, and every year we hold mass vaccination clinics in our schools to protect our kids against flu. So with that, I'll go ahead and turn it back over to Mark, unless you want me to take questions now or later.
No, I think we'll do that at the end.
Okay.
Okay, our next speaker is Hal Grebe. He's Alachua County's Emergency Manager.
Afternoon, everyone. I just wanted to give a brief update about what we're doing here at the Alachua County Emergency Operations Center. We're currently in a monitoring level 3 status. We're leveraging our All Hazards Comprehensive Emergency Management Plan. The framework that we use is what we use for all sorts of incidents and events and emergencies that could happen in Alachua. We're in constant contact with our local, state, and federal partners. I've been in personal contact with all the local emergency management professionals and the public health professionals throughout Florida. Some of the proactive actions that we've taken to date, we've done a virtual EOC drill, making sure that our functions here in this EOC can be done in person and virtually. We've done that for our staff. We've participated with local hospitals in tabletop exercises. We've verified the availability of personal protective equipment with first responders in our local community. And we've initiated public messaging with Mark Sexton and his group as our county PIO. Some of the continuing actions that we've been doing for a few weeks now are reviewing and updating our preparedness and response plans by benchmarking from real-world incidents that we've seen nationally. We're participating in weekly conference calls with our local, state, and federal public safety and public health officials, and we're communicating regularly, very regularly, with our local health department and county officials. We've also been communicating internally, making sure that our departments know what to do if they have to use their continuity of operations plan. We want to be prepared just like we're asking you to be prepared. We're scheduling meetings like today. Believe it or not, this meeting was scheduled over a week ago. We want to make sure that everyone knows that we're being proactive and we're keeping the best interests of our community at the forefront of everything that we do. But we want you to remain vigilant, continue to do the mitigation that the Department of Health is advising, and follow the CDC and the DOH's guidance. And I thank you all for being here and helping us continue this message of mitigation and preparedness.
And finally, we'll hear from the Alachua County Commission Chair, Robert Hutchinson.
Well, thank you all for being here. One of the things to know about Alachua County is we have more healthcare professionals per capita than just about any other community in the South. And that tells us that we are a community that understands science, we know how to do research, and that's going to be essential for people to make the decisions they have to make personally. We also know how to care for one another, and that's going to be very important moving forward. There will be people who will need the help of others through this potential crisis. Like with storm preparedness, which is often what we're talking about in this building, personal responsibility has a lot to do with what the messaging that we're providing to folks. We know that our local government is well resourced. Virtually every county employee has their regular job and they have an emergency job that they do when they're deployed. And for some county employees, that may mean helping with contact tracing. It may help with getting out information to places that may be harder to reach than through normal channels. And of course, we have the first responders, the ambulances and the fire rescue personnel and the police officers who help when necessary. The institutions in our community have been doing an exceptional job of communicating the issues and the concerns. The University of Florida and Shands and Santa Fe and others are all really stepping up. So we've all heard if you see something, say something. That also applies here. And whether it's contacting emergency authorities or just talking to people about something that you see that needs to be handled maybe a little differently, it's very important for us all to know how to talk with others about this situation. There are going to be people who need help with daycare or with shopping or perhaps with any other chores that come with emergencies like this. And so we know our citizens will step up where necessary. Whenever a politician sort of steps up and gives a speech, there's only two things. One is to point with pride and the other is to view with concern. And right now, I'm very proud of our community and everything that we've done so far. And of course, we're going to be looking forward with concern to any other developments that happen. But right now, I feel very optimistic given the level of communication and the degree of knowledge that has been demonstrated by all the folks here. And that's all I'm going to say. So with that, I think we can take some questions.
Before we get to the questions, we just want to make sure citizens know that if they have any questions or if they're wanting to confirm information, there are several resources. You can go to the Alachua County coronavirus site. You go to the Alachua County main webpage, www.alachuacounty.us. And there's a big banner there that you can click on for the latest information. The Alachua County Facebook page, we are in direct communication with Paul Myers at the Health Department. You can go there for the most up-to-date information. You can also go to the Florida Department of Health website, the CDC website at the federal level, but you also have a hotline that goes directly to the state of Florida, and that is 866-779-6121. And with that, we'll open the floor to questions.
How long has this woman been in the area for?
I'm sorry, could you repeat that?
How long has the woman been in Alachua County for? Can you guys the confirmed case?
So I became aware of this case last night when the lab results were released. And so she has been in Alachua, arrived in Alachua County within the last week.
And is she being quarantined here or isolated?
So she's being isolated in Alachua County right now, and any significant exposures to her have been quarantined.
So until she's cleared, then she can go back to Georgia, but for now she remains in Alachua County?
That's correct.
How many people has she come
Okay,
in
folks,
contact with?
let's raise your hands. Sarah, you're next.
I'm curious, has there been any indication on a threshold of cases that it's gonna take for classes to change at the US, Santa Fe College level, at school district level, and then, I guess, what's kind of the tipping point? Is it gonna be on a case-by-case basis, and how close are we to that?
Yeah, Sarah, that's a great question, and I think the answer to that is it's going to be a case-by-case basis. As we get, if we get more cases in Alachua County, it's going to depend upon where that person was, what that person does, what the exposures in the community may be. So without speculating, I really can't tell you what a threshold or a number is, but we'll take it on a case-by-case basis.
Yes.
How many people has she come into contact with, and are you positive you've identified every single one of those people?
So I'm not going to get into the details of the investigation. You all are really, really good at connecting dots. So I can tell you that there were a number of people who were exposed, and I'm very confident that we have identified most, if not all of them at this point.
And do we know where she traveled to? Is that information?
The Georgia Department of Health is leading the investigation in terms of where she traveled to before she came to Alachua County, so I would defer to them.
You said, I think it was last night, the information you have to try and connect the dots, like you just said.
Yeah.
I really don't want you to connect. Can you kind of elaborate what you meant on that?
Yeah, so patient confidentiality is of utmost concern to us, and I would like you to put yourself in this patient's situation, and her family as well. They are entitled and they have a right to privacy, and so we share what we can. It's a 68-year-old female, a Georgia resident, and she's isolated in Alachua County, and her contacts have been quarantined.
If people feel like they have certain symptoms, where exactly should they go to be tested? Should they still call the health department first, or what should they do in this situation?
Yeah, so the county social media backbone really has been instrumental in getting the word out. If you have a suspicion and you have a question about whether or not you should get tested, please contact the Alachua County Health Department. The numbers are out there. They're 24/7. Also contact your medical provider here in Alachua County. They have been advised of this for the last 2 months. They know how to advise you in terms of whether you should get tested, whether you should not get tested. Nobody in Alachua County who has met the criteria for testing over the last month or so has been denied a test. I just want to make that very clear. There is no shortage of tests. If they meet the criteria, they have been tested, and we have gotten those test results back in a very short order.
What qualifies as the criteria to be tested?
I'm sorry?
We're having some sound issues, so if you could repeat the questions that you're asked, because our audience can't hear the
Okay.
questions.
So, I'm sorry.
What qualifies someone to be tested?
So the criteria today have changed from yesterday and have changed from last week because this is a novel emerging pathogen. So the criteria today include if you are hospitalized with a respiratory illness of unknown etiology. In other words, we don't know, we've ruled everything else out, so now we're going to test you for COVID-19. If you are a contact to a confirmed case, you have met the criteria for testing. If you had traveled to one of the CDC level 3 advisory countries and you are symptomatic, you've met the criteria for testing. And now, if you're over the age of 65 and you have chronic illness and you are suffering from a respiratory illness, you have met the criteria for testing. So those are the basic ones. They have changed a little bit to try and broaden the net, but those are the basic ones that we're dealing with right now.
Yes.
So we're live right now, and some viewers want to know, what places did this woman go to? They want to know, is it okay to go to these places? What are some of those places?
Okay, so that's a repeat question. You're asking again, where did this woman go to? I think Paul answered that, but would you like to answer it again?
Sure. Again, the risk in Alachua County is very low from this case. I can tell you that with confidence, and her contacts have been identified, and they are currently quarantined. In terms of where she went, that's up to the Georgia Department of Health to try and figure out. I know where she went in Alachua County, and I know who her contacts are, so the risk to this community is very low.
Sarah?
A popular thing that people want to know about is Gator Nationals. Who's going to make the call if it needs to be postponed, and what's going to be the tipping point? Again, if it does need to be postponed in terms of large gatherings? I know you said that there's no call to cancel large social gatherings yet, but people want to know about Gator National specifically.
So the question is, Gator Nationals is coming up and other events may be coming up. So the question is, who makes the call on those events and whether or not they take place?
Is it event organizers, is it the state, the county health department, who's going to make the call?
So the question is, who makes that call?
When it comes to Gator Nationals and when it comes to other mass gatherings, we have to take a look at the context of the disease condition in the jurisdiction in which the event is occurring. So whether it's Gator Nationals, whether it's graduation, whether it's a spring arts festival, again, in Alachua County, we do not have sustained significant community transmission. So in the absence of that, I'd be very hard pressed to provide the event organizers of Gator Nationals, the event organizers of graduation, spring arts festivals, with anything other than you have to advise your attendees to assess their personal level of risk. In other words, we have a susceptible population. Those who are elderly, particularly those over the age of 65 with underlying chronic health conditions, they should assess their own personal risk and see if they want to attend mass gatherings. And really, that sort of self-evaluation should drive their daily activities, not just mass events.
Yes, I'll get to you next.
So Georgia Health Department is in the kind of front of the investigation. What part does the Florida Health Department have in it? And
So-
why is it the Georgia Department?
So the question is, the Georgia Health Department is involved in investigating the contacts in Georgia. What role is the Florida Health Department playing?
When this person came into Florida, she became our issue. Because she came from Georgia, the Georgia Department of Health has to try and figure out exactly where she was, where she contracted the disease, and who the contacts are in Georgia. We have done that on the Florida side. It's up to Georgia to try and figure out the genesis of this case.
Yes.
How many tests are pending for people in Alachua County?
The question is, how many tests are pending for people in Alachua County?
So if you go on to the Florida Department of Health website, you'll see an aggregate number across the state of the number of tests that have been completed and the number of tests that are pending. I don't want to get into the number of tests that are pending in Alachua County. I can tell you that I do have tests that are pending. I can tell you that I do have scores of negative tests that have been completed, and only one has come back positive. But beyond that, I really don't want to get into the numbers just for consistency's sake. The smaller the community, the more able individuals are to take this level of detail and start to connect dots, as I said, that we really don't want connected just because of patient confidentiality. And I really appreciate you all respecting that.
Yes.
In cases that are pending, if a case turns out to be positive, how soon will the public be informed?
The question is, once a positive test is received, how soon is the public told about it?
You know, across the state, I think that you have seen that delay get shorter and shorter. I can tell you that last night, within hours of that presumptive positive test, the community was notified.
Okay. Any other questions? Okay, thank you all for coming.